Hey guys, this is Dr. Brian Wolfe at Wolfe Physical Therapy and wolfephysicaltherapy.com. Today I wanted to go over a great exercise. It's one exercise for your neck. This exercise is great for anybody who has some neck stiffness, specifically with rotation to one direction side. Sometimes this is a really great exercise for pain going down the arm. You have to be very careful though, because if you do this exercise and the pain gets worse down your arm, that's not a good exercise for you. If you find that the pain is coming out of your arm and actually going higher up the arm and into the neck, we call that centralization. So if you find that you have some numbness tingling in your fingers or some numbness tingling in the arm, and then you start doing this exercise and it comes up into the shoulder, into the neck, this may be a good exercise. We go for what we call a red, yellow, green principle. The red light is any pain that gets worse down the arm. That's peripheralization. That's a red light. Any pain that comes up towards the neck, so it comes more what we call distal to proximal, so anything coming from the hand, elbow up towards the neck, that's a good thing, but it's also a yellow light. So we say proceed with caution with that. And then a green light, anything feels good. So if you're able to do these exercises and you find that you're actually getting a better rotation, that's fantastic. That's what we're looking for. So that's what you want to see with the exercise. If you're not seeing that, consult a physical therapist or give us a shout at wolfephysicaltherapy.com. You can see our contact information there. So this exercise is called cervical retraction or a chin tuck, and I'm also going to show you an overpressure over the thoracic spine that I really like, that I think can help sometimes. And I'm going to show you standing, but you can also do this sitting in really good posture. When I'm first teaching it, sometimes I tell people to do it standing. It's a little bit easier to see good posture in standing. Sometimes in sitting we see this poor posture and it's not going to help a lot. So you want to try this standing or sitting in great posture if you're confident about your posture. What you're going to do is you can either take two fingers and put them on your chin, or what the analogy that I've used with patients, and I heard this analogy once and it's fantastic because everybody does it correctly, is imagine that an ugly man or woman is coming to kiss you and your head's on a shelf, so it can't come up or down, so you can only go forward or backwards. So the ugly man and woman is coming to kiss you, and you're going to pull your head straight back, so straight off that shelf. Okay, and it should look just like this. Almost like you're trying to create a double chin, if you will. Not great for camera purposes, but nonetheless, it's a great exercise. And what you should feel is actually relieving in your neck. Now, I want to show you how to do it with overpressure too, because sometimes I'll have patients do this, and what they'll tell me is they'll say, my neck is starting to bother me right in here. And what I tell them is if you're doing this and you're not getting any pain down the arm, you're only getting pain in your neck, what they can do is you take your fingers, and I say take what's called a modified spot grip. So you're taking the middle and ring finger of both of your hands, specifically. And what you're going to do is you're going to feel the bumps along your spine. These are your spinous processes. So you're going to go to either side. So the left hand's going to go to the left side, right hand's going to go to the right side of these processes. You're not going to push directly on it so it hurts, but you're only going to counterbalance your movement. So my arms are resting. So if you can see that, I'm also not pulling myself into this poor posture. I'm standing up nice and tall. So when I hold this, I'm now going to bring my arms almost forward. So what I'm doing is I'm bringing my hands this direction. It's important not to bring yourself down this way. It's that direction. So what you're doing is, as my head is going backwards, your hands are counterbalancing and bringing you forward. And this is a great exercise to help mobilize the upper thoracic spine. So the upper thoracic spine is right here. It's right underneath the cervical spine, and a lot of times that can become very tight, and it can open up range of motion with rotation specifically. So, or if there's any lower cervical or upper thoracic restriction of the joints, these are really great ways to help fix that. So try this exercise and let us know what you think. You can contact us through wolfephysicaltherapy.com. If you have any questions, please reach out and we can answer those for you.